So I wrote this book, Understanding First Class Dental Care, about 18 years ago. And I wrote it, it's subtitled A Human Interest Story. And by that, I wanted to show pictures of how I grew up. And when I read a book, I like to know a little bit about the author and why would someone become a dentist to begin with, and what is the dental education, and how did they experience childhood. It's too bad we can't let childhood prolong forever, and I guess some people can, but eventually you have to mature and grow up and be responsible. So I wrote this book, and in this book I wrote it with the intent of educating not only patients but dentists, young dentists, or dentists who have been in practice for a while, in terms of what I learned regarding proper therapy. And the book describes with photos what a small cavity looks like, how we treat it, what happens when a small cavity becomes a big cavity, when a crown is necessary, when nerve damage occurs, when you need a root canal. And I also discussed the controversies in dentistry, one of which was amalgam restorations. Amalgam restorations contain mercury, it's a metal, and they were used very successfully for years. As a matter of fact, when I was in dental school at the University of Maryland, and they were teaching us how to remove decay and restore teeth, they were very specific. It was almost like the architectural design of a cavity preparation to support the metal, using chisels and using precise angles. And these restorations lasted for 40 and 50 years. Well, eventually what happened is there was a group of people that said that you can't be putting these silver fillings in anymore because they contain mercury, which is a toxic substance. Well, there was never really any evidence that this was a problem, according to the American Dental Association and all the studies that I've seen. But people were having these silver fillings taken out and replaced by composite restorations. And the other controversy that I talk about is implants. And when implants are great when they're used properly and you can't save a natural tooth. That's another one of the subjects that I talk about in controversies. And then there's other areas that, in terms of how important is the experience of the dentist. What is iatrogenic dentistry? Well, iatrogenic dentistry is dental-induced problems. And by that I mean, it used to be that when you put a silver filling in, there was a precise way of adapting this filling to the tooth. And if some of this metal went beyond the tooth into the gum, it caused gum disease. And that's true in any field. If you're going to perform a surgical procedure or restorative procedure, it has to be done in such a way that you're not causing damage. And it was very difficult, with my experience. I remember that I went to a dentist and I was looking for a position as an associate at one time. Early on, he said, "Come back when you have 10 years of experience." And I realized at that point, it really does take a long time to really get good at dentistry. And I remember that when we were in dental school, there were some students that were kicked out of dental school because they were very good in terms of the academics and reading the books, but restoring a tooth was a different situation entirely. And when you think about it, if you're working on a second molar on the upper and you're looking through a mirror and you're using a high-speed drill with water coming out so you don't burn the tooth and damage it, it's quite challenging to be able to do something like that. And it takes years to learn how to do that. I almost thought about restricting my practice to front teeth. But sooner or later you get good at it, and you got to remember that when you're looking in a mirror in the back of the mouth, your movements are reversed. So these are just a few pointers about the controversies in dentistry, the importance of the experience of the dentist, and I hope this was helpful for you.